James Lake. I worked on inpatient wards in Homerton and the PQ ward in Homerton, and inpatient elderly wards in Newham. Worked as an occupational therapy technical instructor, Band 2, to run groups and make basic assessments and creative groups, and to provide a large amount of patient contact on the wards. PQ unit is an inpatient ward, and the door is locked. It's usually for violent patients who are violent, have a history of violence, or for patients that abscond, for patients that are difficult to treat. For instance, it might require regular forced medication. And
why would they be needing forced medication?
Oh, why? I mean, if it's deemed that you need medication by a psychiatrist, then and you refuse it, that would be deemed that the person is lacking insight, and being unwell and being seen as the only treatment, it is a requirement that they receive the medication, and that would be given through a forced injection.
By restraining them? By
restraining, yeah. They take you by the arm, often be brought to the floor. You'd have your trousers pulled down, and you would be injected with the medication that you're meant to be given.
That sounds the treat. How can someone keep a sense of dignity when they're having their trousers pulled down?
No, there's no dignity in having your trousers pulled down. Your bottom's a sensitive place, and I don't know, for the older generation, that's where you were smacked. So it's a very humiliating thing to have done, I think.
Did you see that happening to elderly people?
Yes.
Really?
Yes.
What? Being restrained?
Yes, they're
elderly.
Restrained. Yeah. If they refuse medication, there has been, although it's denied, although I have heard it discussed in ward rounds, I'm certain that it's been done, they can put a liquid form in cups of tea, which they shouldn't do, but they have been known to do. There'll be antidepressants though.
Oh, yeah. Not like tranquilizers.
No. But once someone came onto the ward, they rarely, well, they'd leave, but they'd be in and out for the rest of their lives, and I haven't developed a faith in medication. I haven't been, swayed. I don't feel it's been proven to me that these medications work very well at all. An example would be a young adult, an actor, and the psychiatrist didn't know what was wrong with him. He was given doses of medication without a diagnosis, and he had a very bad reaction to it. And anyone can read the medication and see that antipsychotics or whatever he was put on has side effects of mental health problems, and this person had a reaction, and he flew off. He became aggressive. He wanted to escape. He couldn't sit still. He saliva, and the psychiatrist, when I sat in the ward round, said that we've uncovered a hidden psychosis, and he was in and out for until I left stopped working there.
But you feel that reaction was brought on by the medication, not by some underlying hidden psychosis?
The fact that he reacted in such a strong way after being medicated, to me, is not evidence of a hidden psychosis. Should really highlight and should really bring into question what effect the medication is having. I mean, that should be the primary question. That's what's been introduced to him. If someone comes back onto the ward, I think you can consider the treatment a failure, within a short time, and people will be in and out of wards for the rest of their lives, from what I've seen.
But psychiatrists would say that's down to their illness.
Yeah, and I mean, even when there's the evidence coming out about the brain damage caused, and someone who's been on medication for a long period having a lighter brain, the damage that has been shown to be caused has been said to be part of the mental illness and nothing to do with the medication. So with the treatment of mental illness being linked, having to be legally treated with medication, we're unable to separate mental health from medication. And if the pharmaceutical companies and the manufacturers of the drugs can get away with saying, well, the mental illness caused the brain damage, I think that's criminal.
Yeah.
There's also a culture that is inhuman on the ward. Staff are, on the whole, not allowed to socialise too much, particularly nurses, with well, they're allowed to, but they're advised not to, because there's the fear of counter-transference, and also there's the idea that if you like someone and you get to socialise with someone, that will affect your diagnosis. So the most evidence for improvement in mental health is socialisation and social therapies, and there isn't that I have, where we sit and spend a long time talking to people and help people in that way, but we are told not to think that we have helped them in any way, that our communication has done nothing for them, because there's a fear that the person will form delusion that they are curing people, which is oversafe. I mean, if you're spending time with someone and you see a positive improvement, I think you can feel okay, you've done a good job personally, and without getting too overblown. So yeah, there's minimal contact, and I'll give an example. There've been a couple of wards where I've worked on where the nurses were extremely religious, extremely Christian, majority of the nurses working, and this was in Homerton, and they would not leave the office. They would look at people outside and they looked terrified. There was no contact. They wouldn't be sitting there talking to people. When they had a bit of free time, they weren't walking the ward and talking to these people because they're people. It's a culture where there is a separation, and someone who is manic, someone who is distressed, I've seen great positive effects of someone talking to someone, taking time with someone, listening, even if it isn't making sense. They need to feel that someone's there, and that person will settle, and they would there would be no need to restrain. And I think that from what I've seen, there's a confrontational, authoritarian air that the mental health nurses have. So they force medicate if they don't behave themselves. They punish in senses if they don't behave themselves. A person that you can't approach on a personal level, they're not there to be a person for you. For a person who is in distress, who needs help, who probably needs people, they are not going to get this from the nurses, and the nurses often only step in to enforce medication, to enforce a psychiatrist's orders, and to make the person obey. And if the person doesn't obey, the nurses will they will force medicate, they will write bad reports, and the person might take longer to come off. They might write a negative diagnosis. I personally believe diagnosis is often a punishment. If you haven't behaved yourself, you can expect a bad diagnosis. And one of the measures for mental health is compliance. The person is complying with medication, the person is complying with treatment, and therefore has insight into their illness. Now, it doesn't matter whether they, how wrong they get it. I mean, there's no any idea of accuracy is a load of rubbish. Any idea that psychiatry is a pure, strict, well understood science is an absolute load of rubbish. That the psychiatrist knows things about you that you would never know yourself is rubbish. It takes power away from you. And there are truths in some of the diagnostics, but on the whole, they don't pinpoint it. They don't know what's wrong with you, and they will force medicate you. Now, you might disagree with that. You might know that this isn't right for you. You might have a fear about the way your reactions to medications. You might know something about the medications. You might not like the way it makes you feel, you might want something to change. Any of that is a sign of ill health. And I've seen plenty of cases of misdiagnosis, and the fact that these people fought against it was detrimental to them, and the doses have increased, and with increasing, with each worsening diagnosis leading, it leads towards schizophrenia, mostly, or bipolar. The medications are incredibly strong. Social therapy has been proven to be one of the best ways of treating people, as has, we don't know why, but good nutrition has been proven to have a very positive impact, positive correlation. You don't know why. You'll have the worst food, you starve in hospitals, people starve to death in hospitals, the food is awful, overcooked without any nutrients in it, just in case they die from a food poisoning, instead of feeding them. So yeah, there are lots of problems in it. The psychiatrist will not spend time with you. The psychiatrist will know nothing about you. The psychiatrist will make a diagnosis based on a very short meeting, and he or she has got a lot of people to get through, caseload after caseload after caseload after caseload, and they will make all their diagnoses on the way someone responds within a short time, based on statistics and things like that. Nothing to do with you. It's not patient centered. They will be given drugs that make them overweight, and they cause serious harm. I mean, there's high risks, there's health problems with all of the medications, and they are the first port of call. Traditionally, psychiatric medication used to be the last port of call. Now it is the first and pretty much the only treatment you can expect. If you see a psychologist, they will tell you that they don't have time to go over things. If we were going to have longer together, they would do something. So it doesn't work. It seems to be propping up the pharmaceutical industry. It's propping up psychiatrists who make hundreds of thousands a year, who don't know the clients, don't get to know them, aren't interested in the clients, and I feel have done genuine harm to people, and it's not right. It's not right. Something that works, the whole system is failing people, and you can go into the system to try and fight it, to make a difference to these people, but ultimately they'll be putting on mind-altering medications with strong side effects that I think can contribute to mental health problems. I mean, people have described being on antipsychotics as having the self-awareness of a slug, separated from yourself. And I don't know, imagine a young, beautiful person within a few years, bloated, overweight. The medications make people very hungry, so they'll have a meal and then they'll go and get a takeaway as well. And they balloon. It's likely, I think, and I think more and more people are speaking out about it, that medications can cause endocrine damage, and endocrine in the liver help you deal with the hormones, and also for weight control, and the damage can be permanent as well.
Yeah, the Parkinson's disease type, the shakes and the tremors,
nerve damage.
When people get that is irreversible.
Yeah.
And that's brought on by the antipsychotic.
Yeah, nerve damage. And what is your brain made out of mostly? It's neurons.
Mm.
And they have similar composition. Most of them have high cholesterol, so it's causing some serious problems in the body. All the medications have side effects, so you have to have medications for the side effects. I mean, anyone who's watched a documentary about mental health has heard this 100 times. Side effects need to be treated with medication, which have side effects, which need treating with medication, which have side effects. It increases the toxic load. They're toxic, these medications. And they don't know what they're doing with them. They're addictive, and they do harm, and they're not even proven to have worked. They have the power of diagnosis, and we believe we're living in a scientific age where things have been proven, and that some people feel that we've moved forward. and that psychiatrists know what they're doing, and the psychiatrists believe they know what they're doing, but it has a very low success rate, so obviously they don't. Another very important thing to note is that psychiatrists get to create diagnoses. They have meetings to create diagnosis where they will apply a medication which was proven to treat one ailment, and they will apply it. And they say, well, we tried it. All human experimentation, and it's a very low success rate. Very low success rate, and I have to say, from my personal opinion, I saw very few people get well. It was a case of in and out for the rest of their lives. With a quick tune-up with these things that cause nerve damage, brain damage. Very intelligent people finding it difficult to read. Very intelligent people finding it difficult to even draw, use their hands. Yeah, so this, as I was saying, this guy was with learning. I believe had learning difficulties. I don't have the power of diagnosis. He was rebellious, he sought to be a character, he was a believer in freedom, and the more the mental health services closed down on him, because the wilder he got. And these were treated, his behaviour got extreme, like he shot himself, which in a way which I feel was in protest, being handled and various things like that. Then he'd scream and he'd, have tantrums and things like that. So increasingly his diagnosis got worse, his medication got more potent. So he'd becoming, dribbling increasingly, more incoherent, and to me apparently more ill, but probably easier to manage when heavily medicated. And ultimately he was put on ECT. Now, I'm sure it's been excused, but it seemed mostly that's because they've tried everything, and this is the last thing that they could, the only thing they hadn't tried. And I was the only one to socialise really with him. I became the only person he would respond to. I almost became like an ambassador, between him and the psychiatrist. But being in my position, I was very little I could do. Didn't have any power. I could see things I didn't like, but I don't have the power of diagnosis. I don't really have the power to say anything. And he was put on ECT. There's no evidence. They don't know how it works.
What was the effect? Or do you know how many times he had it?
At least 2 or 3 times, and that was just about when I was leaving. I don't know what's happened to him. So all I know is that he was calling my name before, in fear as he was being taken in for the ECT. He was very worried about it. It was very frightening for him. He didn't really know what was going on, and I'm sure ECT hasn't done anything for him. I mean, people that have had ECT, I've seen a young person who was very depressed. He was given ECT, and then he was manically happy, blissfully happy, and then he was soon depressed again. And this was the cycle.
I've heard the same.
Yeah, this is a cycle. It's not a treatment. It wasn't long term. Medication, ECT, no social therapy. That's it. Mother and baby unit I've worked on for a time. There is a correlation between medication and birth defects and other things like that, and so mothers will be put on medication, and the risk of harming their future child, having to deal with suicide risks. Medication is often applied, and suicide is the reasoning behind a lot of treatments, particularly the closed wards, suicide risks, medications and various things like that. And there are side effects of medications is suicidal thinking. I don't know. There's lots of contradictions with it. I don't know. I don't think it balances out. I don't think the improvements are worth the risk with the medications.
But with these elderly people, what sort of medication were they putting them on?
It'd be the full range, everything from an adult, everything that the adult mental health patient would be given. They would often treat Alzheimer's with antipsychotics. There's no evidence that has any effect. you know, there's no scientific backing for it. It's just a decision. It's experimentation, and I personally felt very angry and left because of this treatment. And it's only in the last couple of years that there's been some. It's been publicised that it's not appropriate. That it has strong side effects, and we're aware that these drugs. It's common knowledge these drugs, you know, cause brain damage, whether temporary or permanent. And so for Alzheimer's, I can't imagine, you know, I think that's hideously stupid, but that's a personal opinion. Well, no, there's, depending on the ward, for closed demential units, clients who have dementia but are still physically fit and active will be often made to sit down rather than walk around, do just even the basic exercise, and they'll be sitting down for most of the day and become increasingly crippled and in a lot of pain. I mean, not moving causes you know, quite a great deal of pain. They end up with bed sores. They lose the ability to walk from not walking. No, it's not adequate. It's cruel.
Why were they trying to encourage them to stay sitting?
Well, because there's not many staff, and it's for management, just to manage people sitting rather than anything else. So in relation to antipsychotics, I think they have pretty strong side effects. They can have the side effects of aggression, and definitely aggression, and akathisia, which is the uncontrollable walking or uncontrollable movements, and you know, certain levels of anxiety with it as well. And these elderly patients are being given, and I think they probably still are giving powerful antipsychotics with side effects and are unable to speak about the side effects. I don't know, the chronic tensions, having akathisia and needing to walk but not being able to walk at all, I would imagine to be quite cruel, really. But there are really powerful side effects. The thing is, I've worked in mental health. I've seen a lot of them, and these people cannot respond, cannot complain about it, can't say anything, can't, I think that's cruel.
Why can't they say anything?
Because they're suffering from severe dementia, some of them. With dementia, you saw a real degradation in their personality. They might not understand, might not be able to communicate in any way at all, might not seem to understand what's going on. Dementia ward, I would say that the essential care is given. So, the person is being kept alive, everything will be done to keep them alive. But I don't know whether they are living. And what I mean is that the environment is horrible. It's a horrible environment. It's inhuman. It isn't pleasure environments that improve our mental health. And on mental health wards, the idea is to keep them as sterile as possible, and it's under the assumption of the hermetic seal, and a hermetic seal is where you stop outside influences affecting something so that you can test what is affecting it. And that is the idea behind all of the wards, even a dementia unit where you're testing and you're experimenting. I mean, you're not meant to experiment on humans. I mean, you're not meant to without their consent. So experimenting with the elderly with antipsychotics, they're finding nothing. All they're doing is doping people. It's a form of doping. Their environment is horrible, and they often appear to have forgotten something after you've met them. But over time, although they don't seem to remember who you are, you've developed a relationship. So I feel, positive stimulus, positive environment, lots and lots and lots of small positive things could only make a difference. And a sterile environment it's bad for everyone. I think it's horrid. They're just degrading.